Welcome everyone. Thank you for joining us for today's VIO webinar. My name is Jimin Seo from VIO and your host today. Today we're presenting advantages of both pulsed and continuous wave technology with the Sylfirm X. Can your RF microneedling device do this? And our guest speaker is Dr. Steven Shapiro, who is the professor of University of Miami and director of the Dermatology and Cosmetic Surgery Center in Florida in the United States. Before we begin, I'd like to mention that there will be a question and answer session after the speaker's presentation. So if you have any questions, please leave them via the Q&A icon on the control panel located at the bottom of your screen. Now, please welcome our presenter, Dr. Shapiro.
An example of tissue temperature's effect, if you use continuous wave energy, what will happen is you can raise the target tissue temperature above 60 degrees. When you do that, this leads to protein denaturation or collagen coagulation, and it basically starts a wound. And as that wound heals, the dermis remodels, and you'll get new collagen, which will tighten the skin. And you'll typically see textural changes in the skin, which is a nice benefit of continuous wave technology and that elevated target tissue temperature. When you use pulsed wave energy, what happens is you won't get that high a target temperature because you're giving intermittent pulses, although over a very short period of time. So your target temperature could be between 42 and 45 degrees. And when this happens, you'll get some protein structural change or collagen shrinkage, and it will create a wound, but not the same type of wound and the same type of tissue remodeling. This works better for pigmented and vascular lesions such as melasma and diffuse redness. We'll talk in more detail about this. The depth of penetration, excuse me, at 300 micrometers in the papillary dermis. The papillary dermis contains elements that interact with the basement membrane zone, the epidermis and type 3 collagen more than the reticular dermis. This is also where your sleeping fibroblasts are from old sun damage. And this is also where some of your superficial blood vessels are. So as you work in the basement membrane zone, you'll get a different benefit than if you work in the reticular dermis. So again, look at where your target is, what you're trying to achieve. But when we're working at the basement membrane zone, we're actually able to reduce pigmentation and background redness. So Sylfirm X, the depth of penetration is 0.3 to 4 millimeters, which is the widest range of all the devices. Excuse me one moment. And the depth of 0.3 millimeters targets the papillary dermis, or the upper dermal layer, located just below the basement membrane zone. And this is where those fibroblasts and type 3 collagen are largely located. The 300 micrometer targeted treatment minimizes procedural pain because it's very superficial. It reduces the downtime, it speeds the recovery, and dramatically improves pigment caused by aging, and strengthens the skin barrier and maximizes the effects of collagen production. Deeper penetration affects the reticular dermis for that deep skin tightening. So the microneedle tips, there's two types of tips in general, insulated tips and non-insulated tips. The insulated tip only allows the energy to be dispersed from the non-insulated very end of the tip. This can be typically associated with more pain and a deeper tissue temperature at the tip. The non-insulated tips disperse energy throughout the surrounding tissue, and this follows the Na effect. So we'll talk about this because the Na effect is very important here. If you take a look at this bottom left-hand part of the screen, this demonstrates the Na effect where with your non-insulated tip, you would expect the energy to be dispersed evenly throughout the entire tip itself on the periphery. But instead, we get that teardrop or water drop appearance, almost like a Q-tip. And most of the energy is towards the tip, and it's not dispersed evenly as we would expect. So this is an effect in physics, which is important in this device. If you take a look at the right side of the screen, you'll see the skin depth going from proximal, middle, and distal. And then you'll see the time, the conduction time of the energy. So what's interesting is if the energy was dispersed evenly throughout the tip, you would expect all these little holes or cracks in this tissue to be the same. But you can see that most of the energy is dispersed distally, which again proves the Na effect. And then as you use your increase your conduction time, you'll get bigger holes towards the end of it. So it's really interesting. The NA effect is important here because we're using non-insulated tips with the Sylfirm X. So we originally started with the Scarlet, and then we evolved into the Sylfirm X. And I'd like to point out the Scarlet RF is continuous wave technology, the same continuous wave technology that's in the Sylfirm X. So when this was one of our original patients, and we were trying to figure out what we would get with the Scarlet. And we didn't have to go very deep, but we went between 1.2 and 2 millimeters deep. And we're able to treat the face here at the same energy. And when we were able to do it, if you take a look at the forehead up and through here, she has a pretty smooth forehead before and after. So she did well in that area. But if you look at the crow's feet in through here below the eye, she's got some tightening in through here. And she's very significant towards the bottom of the nasolabial fold and the chin area. So her chin is much more smooth in through here. She's got a reduction of the wrinkles at the jawline. Radiofrequency devices tend to work very well on thin tissue over bones. They can also be a little bit more painful in that area. So, but I would expect to see more benefits around the orbital rim and towards the jawline, which we were able to see with this patient. She was very, very pleased with her result. So this is our Sylfirm X, and actually I keep it behind me in the office. It's on wheels, so we're able to move it around the office for multiple providers to use it. So the mechanisms we spoke about before, continuous wave treatment and pulsed wave treatment. Remember, the continuous wave is suitable for skin rejuvenation, tightening, lifting, and scar treatments. Most, pretty much all of the radiofrequency devices out there use continuous wave. But the advantage of the Sylfirm X is having that additional modality of the pulsed wave. And that pulsed wave, as I mentioned before, you can use for pigmentation and you can use for background redness. And both of those are part of photoaging of the skin. So pulsed wave treatment for pigmentation. This is one of my favorite articles because it really opened my mind. This was about senescent fibroblasts and melasma pathophysiology. And as I read this article, I recognized that, we're taught to think of pigmentation as melanin. It's not just melanin. If you can regenerate or activate older fibroblasts, that will improve your reduction or normalization of the pigment process. At the same time, you're able to treat superficial blood vessels. So if you think about it, if you have red under brown, that's going to make that brown more noticeable. So reduce that redness, and then you activate these older fibroblasts, you can reduce the pigmentation that way. So this is type 3 collagen and the 0.3 millimeter targeted therapy. So in this slide, you'll see the collagen on the left versus the collagen on the right at the same depth before and after a treatment with the Sylfirm X. And that type 3 collagen shown with staining is increased. So not only were we able to affect melanin and superficial blood vessels, but we're able to affect the collagen at the basement membrane zone. So, we're trained to go very, very deep at a high temperature, but really we're getting benefits here, not as deep and not with a higher temperature, but with the pulsed wave technology. So these are a number of clinical published papers. I put down in here the senescent fibroblasts and melasma pathophysiology. That's my favorite article in here because that really talks about the effects of fibroblasts and blood vessels, superficial telangiectasia with hyperpigmentation. So what is a Sylfirm X? I'd like to talk about the specifications. Of course, it's radio frequency, it's bipolar. The frequency, as you compare different devices, this is 2 megahertz. Remember, we have the continuous wave and pulsed wave. We have 4 different modes for each one of them and an energy intensity of 0 to 12. So we really have a wide range of control with this device. The needle depth is 0.3 to 4 millimeters, adjusted at 0.1 millimeter increments. And the tips themselves are 5 by 5 pins or 25 pins to a tip. And it can run off of 110 or 220 volts. The user face is very intuitive. If you take a look on the bottom left of this slide, you'll see the continuous wave 1 through 4, pulsed wave 1 through 4. And there's even a visualization to show somebody that, continuous wave 1 is a shorter time on top of the skin or into the skin than CW4. Same thing with pulse wave 1. It's a longer pulsed interval as you go to 4. You can adjust the interval between your pulses, the interval time. The depth of penetration, whether it's single or automatic, pressing the foot pedal to get your shots. And here's an example of a setting here with continuous wave for short interval between pulses, 2 millimeters deep and a power level of 6. My favorite part of the device is right here. The foot pedal actually attaches to the side of the device. In our office, it's frustrating to me to see a foot pedal that sits on the floor sitting on top of a laser. So seeing that magnet on the side, I know that that foot pedal stays away from the tip to keep everything clean. There's storage space for your tips and your post-op treatments after, and the arm is very easy to use. So this talks about the interval, the depth, the power, single or auto modes, standby ready, shot count. So there's basically 6 different controls that you have. As I mentioned before, very, very simple to use, but you have your full screen here where you make your choices, and then you'll have what you set up for the patient. So very often we just take a picture of the screen that shows our settings for that patient. It goes right into their chart, so we don't have to put in all the information individually. So the main features of Sylfirm X, it's the world's first dual wave microneedling device. It has both continuous wave and pulsed wave. It treats pigment and vascular lesions. So we're able to treat melasma, diffuse redness. We're able to perform skin rejuvenation and treat scars. The dual wave provides 8 different modes. Remember, 4 of continuous wave, 4 of pulsed wave. And we're able to customize for individual patients exactly what they need based on their indications, their skin conditions, and how delicate we want the treatment to be. It's the world's only 300 micrometer targeted therapy. 0.3 millimeters belongs to the papillary dermis, just under the basement membrane zone. And then we're able to affect collagen, fibroblasts, and superficial telangiectasia in that area. So we're able to treat the pigment and vascular lesions. We're able to strengthen the basement membrane zone, which aids in overall skin health through regeneration. There's numerous papers available, and this is solid state technology. Our device never goes down. This talks about the modes again, and for continuous wave and pulsed wave. And again, we have a lot of different controls that we can use. So we're able to treat everything from inflammatory acne, rosacea, skin tightening, diffuse redness, melasma. We're able to do treatments on the face, the neck, the body. So we're able to treat all of these different areas. Here's an example of skin tightening. If you take a look at this patient on the left, you'll see wrinkles around the eyes, the crow's feet. You'll see her forehead area where she's got some mild wrinkling before. Interesting in the photo, you'll see a reduction in some of the color of the skin. So it was one of those things that at the very beginning when we were using it, we looked back at our photos. And as we look back at our photos, we saw that reduction in brown, that reduction in redness, even though we were trying to get skin tightening at the same time. So this is before and after 4 treatments for forehead wrinkles. Again, it's thin skin over bone. I would expect it to do very well, which she did. You'll take a look at the wrinkles around the eyes, really softened that area for her. Her smile lines in through here, she's softer, but also there's a reduction in some of that brown discoloration. You can see it on her left cheek here, and reduction in some of that redness. So she's lighter in color in her after treatments. This is another patient who had 2 treatments with the Sylfirm X. And, typically we'll see improvement in the texture of the skin. So if you look at her left cheek, there's some unevenness to her skin, and she has improvement in that area. The skin of her around her jawline and through here. If you take a look before, she's got some deep wrinkling at the mental crease, at her marionette lines, the bottom of the nasolabial fold. And the way that I look at pictures, I always say, which person would I rather be? I'd rather be this one with less of a mental crease and less of a marionette line and less of a nasolabial fold. And that's with just 2 treatments. This is another patient who has severe sun damage. So we combined continuous wave and pulsed wave. We did 2 treatments of each, 4 treatments total. And if you look at her forehead area, we're able to reduce the pigment that she has in the skin. Unfortunately, this patient still goes out in the sun every day. But even with that, we're able to get improvement in her background redness and her pigmentation. At the same time, we're able to get some skin tightening for her. If you look at her marionette lines and through here, a little bit softer after. If you look at the below the eyes and through here, much softer as well. This is a patient which was interesting because she had active acne lesions. She had some acne scars, but she also had that background redness, and she also had was looking for some improvement in tightening of the skin. So if you take a look on her left temple, right in through here, she's got an acne scar, and that's before and after 3 treatments, and that scar is basically gone. She has some active acne, which improved, but she also has a reduction in that background redness. I have some pictures of her where we did more treatments. This was after 9 treatments. She was one of our study patients, and we just kept going to see what benefit we would get. So she had improvement in her acne. She had improvement in acne scars, reduction in redness, and some tightening of the skin. So let's take a look at the photo. If you look at her forehead, she has prominent pores in through here, much softer after. If you take a look at her cheeks, again, prominent pores, some old acne scars. These are pretty much gone. If you take a look at her nasolabial fold, corners of the mouth, mental crease, although they're not very deep to begin with, they're pretty much gone. So really saw some nice changes as we continue the treatments. I wanted to continue the treatments too to see, are we going to maximize the benefit? And that's been interesting with this device. If you continue treatment, I call it collagen remodeling therapy or collagen maintenance therapy. You're able to help them maintain their benefit as you continue treatments. There's a patient, I like this picture because we were treating redness, scars, wrinkles, and texture of his skin. The problem is after he was so happy, he wouldn't stop smiling. So we could not control that. But if you look at his forehead, for example, he's got multiple wrinkles in through here. He's in his 70s and they're almost gone. He's got really old acne scarring. He's got some deep wrinkling, much softer, although he is smiling, so that gives some muscle motion. But you can see his chin, and his chin to me really gave an example in his picture. He had this these deep furrows in his chin. After 5 treatments, they were gone. So again, we could not get him to stop smiling because he did so well with this treatment. This is the chest, and it's really interesting as you get off the face and the neck. I mentioned before, thin skin does really well, especially over bones. So when we were working on the chest, what we noticed is that, there's not much sensitivity to the device, so we can really, increase our depth, increase our energy. And this was after 2 treatments, and you can see, there's a little hemangioma here before and after. So we didn't use pulsed wave technology. We used continuous wave. And then you can see on her neck, there's a reduction in wrinkles on the neck, but the décolleté or the V of the neck, I mean, she really has a significant reduction in the wrinkles that she has in that area. So as we kind of evolved with this technology, we've been able to move off the face and the neck and get some really, really good treatments and some good results in different areas. I'll show you some pictures later where this technology also plays well with other therapy too, in combination. So this is for redness reduction, and this was from a study that was done towards the beginning. And what I like about this, it shows before the treatment, background redness in the skin, after 3 sessions, a reduction, especially if you take a look at her left upper cheek, there's a great reduction in that redness in through there. If you take a look at 5 sessions and then 1 month after the 6th session, you can see from the beginning to the end, a significant reduction in redness. So other uses can be for body tightening, for acne, active acne, acne scars, for drug delivery, for syringomas, for axillary hyperhidrosis. Just one thing on drug delivery, with microneedling, it's been shown to grow hair. So we do treat the scalp, and we've noticed that patients end up with more hair in their scalp. One of our staff just recently used 2% hydroquinone peel after RF microneedling, and we were able to get significant reduction in pigmentation that way as well. So what I like about this technology, it really plays well with other technologies too. So this is from Trina Barr, a friend of mine out in Colorado, and she was treating the buttocks, and this was with 1 treatment. And if you take a look, in her photo, the left buttocks in through here really shows a reduction in the dimpling that's in that area and skin tightening in that area. So the contour is much smoother than what it was before. So if you take a look, you'll see it here versus here after. This is not a common treatment that I do, but it's just nice to know that you have body contouring with this device as well. Her right buttocks in through here, again, much smoother in through this area. Trina also combined it with plasma therapy around the mouth, but this is straight Sylfirm X on the forehead and the upper cheeks. She added the plasma technology around the mouth. But if you take a look at the eyes in through here, again, thin skin over bone does really well. And this was one treatment with continuous wave at 4 and one treatment with pulsed wave at 2. So this is after before and after only 2 treatments. And then she just did the jet plasma for perioral area, which that's a very painful procedure. So, it's different than this. This is a great picture that I like to show for acne and acne scarring. This is before and after one treatment. So this reduced the acne or active acne lesions, and at the same time, it reduced the pigmentation associated with acne and acne scarring. So, it's something to think of. If somebody has active acne lesions, this is not contraindicated to perform this procedure. And this one, I actually have to confess, is my son, who he had some active acne on the forehead area. He had some old acne scars from puberty. And what I was doing, I was trying to combine therapy just to see what we could achieve for acne scarring. Now, I know Sylfirm X can be used for acne scarring alone, but sometimes what I'll do is I'll combine things at different levels of the skin. So we used an infrared laser. We used a different laser that caused laser-induced optical breakdown at a midpoint in the skin. And then we used the Sylfirm X more superficially. And it's interesting, as I look at the photos on him, because we were working just beyond the basement membrane zone, I was in the range of about 0.5 millimeters deep with him. We were able to get some reduction in some of the redness that he has. Redness in the cheeks and through here is reduced. Some of the brown pigmentation in the scars, that's reduced as well. And we were able to significantly reduce the number of scars that he has, but we were able to reduce how each scar itself responded. So the scars weren't as deep, they were more superficial. Some of the really superficial scars, if you look towards the mouth area, these scars are basically gone. So some of the scars are eliminated if they're superficial. If they're deeper, they become more superficial. We're able to reduce some of the discoloration associated with them and some of the redness with them. So it made Mom very happy. This is for pigmentation after 2 treatments with the pulsed wave, 1.2 millimeters deep at a power of 5. And what's really interesting, she used Sylfirm X, this from Trina, and she used exosomes. So right after the treatment, she was able to use it for drug delivery. So that's something to always keep in mind with microneedling and RF microneedling devices, that you can really combine therapy. You can add medication on top of it to increase the penetration. So it really plays well with other modalities. So in conclusion, what we're talking about today is the Sylfirm X, the progression of microneedling, RF, how we got to the Sylfirm X. We started with Scarlet, continuous wave going into pulsed wave. You want to compare your target temperatures with each device. Again, there can be a range from 47 degrees to 70 degrees. Does it have pulsed and continuous wave technology? That's why I say, can your RF microneedling device do this? You want to know about the depth of penetration and the type of tips that are used. Patients don't understand this. They'll come in and won't just give the brand name of a different device because their friend had it. We really need to understand the science and how to compare the different devices and what they do. We have many more parameters and much more control with Sylfirm X, which I like. And we have many uses. We can use it for skin tightening. We can use it for melasma. We can use it for background redness. We can use it for blood vessels. We can use it for acne scarring, acne, and hair growth. One of my targets in South Florida is poikiloderma. Poikiloderma is where you have an increase in pigmentation, a decrease in pigmentation. You have telangiectasia, and you have atrophy of the skin. I feel with the Sylfirm X, we're able to target all of those. So we're able to blend in the pigmentation between the hyperpigmentation and hypopigmentation more evenly. We're able to work on that background redness, able to work on the blood vessels, and able to work on the atrophy of the skin with skin tightening. And keep in mind that RF microneedling really works well with other technologies. So combination therapy, I really believe is the wave of the future. One day you'll offer somebody a facelift, where you're surgically removing extra skin, or you can offer them, a couple different devices that are non-ablative and non-invasive. And hopefully we'll be able to get a very similar result someday combining those therapies. And I want to say thank you very much for listening to me today. I'm here from Florida. This is a picture of our sunrise, and it hasn't quite happened yet, but it will be soon. Thank you very much.
Let's have a Q&A session right away. Just a reminder, please be sure to leave your questions using the Q&A icon on your control panel. The first question is, when treating melasma, do you use different parameter settings for different skin types?
Yes, I do. So the first thing I do with pigmentation is I use what's called a Woods light to determine if the pigmentation is superficial or deep. And, very often it's a combination. But if that person is, 75% epidermal pigmentation and 25% thermal pigmentation, I'm going to go, I won't go as deep. I'll keep my needle more superficial. And then if the pigmentation is deeper, then I'll go a little bit deeper when I treat them. As far as skin types go from 1 to 4, I Woods light all of the, or 1 to 6, basically, I'll Woods light all of them. But it's really interesting to me is that I'm more interested in where the level of the pigmentation is, as apart from how much pigmentation they have. So if a skin type 3 is mostly epidermal, I'm going more superficial. If a skin type 1 with the Woods light shows deeper pigmentation, I'm going to go a little bit deeper. So I do take into account the patient's skin type, but at the same time, I'm really looking at where the pigmentation is located. And, life would be simple if it was 100% dermal or 100% epidermal. Very often there's a mix, but what I try to do is focus on where the pigment, most of the pigment is, and go in that direction first.
Do you provide special pre-treatment care or post-treatment care after Sylfirm treatment?
Yes. So this will depend on the patient. I think this is a very good question. So if the patient is an older patient who has a lot of wrinkles, typically we'll use like a hyaluronic acid product after, which is kind of soothing when it goes on top of the skin. It's going to be absorbed through the small channels in the skin. So we'll give good hydration. Sometimes we'll use exosomes. And if it's a younger patient with acne, we'll use a moisturizer that will not cause acne. And then pre-treatment, down in Florida, we're treating photoaging most of the time. So a lot of the patients are on a skincare routine. I let them use their morning routine that day, and then we treat them. We do the treatment later on that day. And in Florida, very often we'll put a sunscreen on after the treatment if it's morning. But very often we're doing these treatments in the afternoon, and they go straight home after.
How long does the redness and downtime last after neck treatment?
So this is a great question about the neck. How long does that redness last? Very often it depends what the person brings into the room. So if the person has redness in their skin, a lot of it, they tend to hold that redness a little bit longer. My record is the next morning. So typically it's about 5 to 15 minutes. And then very often we see them dissipate by the next morning if they have severe redness in the skin.
If the patient wants a skin tightening effect on décolleté, which parameter would you recommend?
Right. So for skin tightening on the décolleté, what I like to do is use continuous wave. And I know that on the neck area, they tolerate it pretty well. On the chest area, they tolerate it very well. So typically what I'll do on the first treatment, I'll start with like a continuous wave 2, and I'll use an energy of about 8. And then on the chest area, I know that I can go to 3 millimeters deep, and I'll probably go to continuous wave 3. And with each treatment, I view heat and radio frequency as kind of like jumping into a pool that's really hot or cold. That first step, you feel the drastic change. And then as you take each step, you become accustomed to it. So it's common for me with each treatment to progress the depth of penetration and the duration of the energy. So from continuous wave 2 to continuous wave 3. So I'll do progressive increase in energy and progressive duration of the energy into the skin.
With that question, and how many passes do you normally do per session?
So that's actually a great question. I don't have the patience to do many passes. So I typically do one pass, and then for the key areas, I'll do a second or a third pass. So to give an example, on a face, I'll treat the scalp, I'll treat the face, I'll treat over the mandible because I know over the bone I'm going to get better results. So that will tighten adjacent skin. And then what I'll do is around the eyes, I'll do an extra pass, smile lines, corners of the mouth, I'll do an extra pass in those areas. Most important thing is remember you want to retract the skin back. You know, I always feel like I'm stapling the skin back and that holds it back. You get better results that way. You'll also stretch the surface area. You use more pulses. So even though I don't use a lot of passes, I think I use more pulses because I really stretch the skin when I treat the skin.
Okay. The next question is, are there any precautions to be taken when treating sun damaged patients with Sylfirm X?
So this is a great question. So in South Florida in the summertime, we see very, very strong sun. And, you know, one of the things that I like to do is look at the watch to see how much of a tan line there is. And that gives me an idea how much sun the person's getting. So I do worry about darker skin types with activated melanocytes, and those activated melanocytes dropping pigment into the skin and getting a reverse hyperpigmentation. I've not seen that yet, but what we typically do is I tell patients, you know, they have to wear sunscreen. That's the rule. They have to reapply every 2 hours to make sure they're protected. The only time that I would be hesitant to do a treatment is if the person went, for us in Florida, it's the Bahamas, where they're spending 8 hours a day in the sun. So my average patient in the summertime will play a round of golf. You know, they put the sunscreen on twice. I'll treat them no problem. But if somebody tells me, hey, I went to the beach yesterday for 8 hours, I'll hold off the treatment just to be safe. And I do that with a number of different devices down here because I worry about those activated melanocytes losing some of their pigment as they're treated.
Can we treat stretch marks with the Sylfirm X?
Absolutely, you can. You know, I have my way to approach stretch marks. I think there's epidermal atrophy and deep atrophy. And again, just like pigmentation, you can have both. The superficial atrophic scars do really, really well. So Sylfirm X, absolutely for that. You know, the deep one where you have a deep loss of tissue, you'll improve the texture superficially and you'll get some benefit underneath. But you know, to me, I divide the stretch marks into superficial and deep. Superficial always, deep you'll get some benefits as well. As you saw in treatise pictures, you know, sometimes if you combine therapy, you may even get something better for those deep areas.
Okay, it's gonna be the last question. You said that you use the laser and Sylfirm X for acne scar treatment. Which device should be used first? And can I use both devices on the same day?
I love this question because I have my opinion and I've discussed it with different people, and I think that nobody's in total agreement, but my opinion, which I feel strongly about, is that I think you have to work from deep to superficial, and I always do them on the same day. So to give you an example, whenever you fire a device into the skin, you're going to have some denaturation of tissue at that level, and that'll create what I call like a cloud. So for me, if I'm going to use an infrared laser and go deep, you know, some of them go 2 to 4 millimeters deep. I'm going to use that first. I'll get that denaturation or cloud there, and then I'll use a Sylfirm X more superficially up above it so that I'm not going near that other tissue. I believe that if you denature tissue first and then try to get a laser to penetrate it, it's like an umbrella. It's just not going to penetrate it very well. Again, this is, I've seen this with nail fungus and lasers. We use a 1064 to 532. I always fire the 1064 first and then the 532 second. I believe that you have to work at the deepest level first. You'll get a little cloud or denatured tissue there. And then that way you don't have to try to penetrate that to go more superficially. So that's my opinion. You know, one day somebody's going to do a study where, you know, we treat one side of the face one way, one side of the face the other way to see who's right or wrong. but I feel very strongly you have to go deep to superficial, and you can do them on the same day.
Okay, one more question about the acne treatment is
Yes.
that for deep acne scars, how many sessions you recommend?
So this is a great question, and every patient will be a little bit different. I view deep acne scars, which is what my son had, as you're going to get a certain percentage or degree of improvement. So if you can bear with me on this analogy for a moment, let's just say we get 50% improvement with each treatment. There's an old analogy where if you're 10 feet from the wall and each step is 50%, what'll happen is your first step, 50% of 10 feet is 5, your next one is 2.5, then 1.25. You come as close to that wall as possible without touching the wall. So I think acne scarring is very similar to that, is that your first few treatments will be dramatic. And then from there, you'll start to get as close to that wall as possible, and your changes won't be as dramatic. So it's hard for me to say the number of treatments because it's going to depend on the patient. I've seen scarring respond very quickly in 3 treatments, but I tell those patients to keep going, and I'll start to change the interval. It takes 3 months to grow collagen. So what I'll do is I'll do monthly treatments to start, and then after that, I'll back them off to 2 months. So, the average patient starts off with minimum of 3. I typically will go to about 5. And that's the way that I approach it. And then we see where they are from there. And, if they're responding really well, they're fine. But I'll start to space out the treatments 2 to 3 month intervals, get the full benefit from the previous treatment before I do another treatment. And 3 to 5 is pretty much my average.
Okay, thank you for all the answers. Before I finish, I'd like to thank Dr. Shapiro for the wonderful presentation and to the audience who participated in today's webinar. I hope that you had an informative time. All necessary questions will be answered by email within 1 to 2 weeks. And if you have any other questions, please feel free to contact us at the email address shown on the last slide. Thank you again for joining us today, and see you next time.
Thank you very much.